What if we told you that your golden years could be shaped by a single decision: your zip code? In 2025, as healthcare costs skyrocket and Medicare policies shift like political winds, choosing the right state to retire in could mean the difference between thriving and barely surviving. With hospitals overflowing, doctor shortages creeping across the nation, and seniors waiting months for appointments in some states, others are quietly building healthcare havens that few are talking about. These 10 U.S. states are rewriting the rules of retirement, and the one ranked number 1 will absolutely shock you. So why are thousands of retirees fleeing traditionally popular spots and resettling in places they never considered before? And what dark truths are hiding behind states that aren't on this list? Stick around, because this is more than a countdown, it's your future. Number 10, Wisconsin. If you're picturing snow, cheese, and the Packers, think again. Wisconsin is quietly becoming a retiree healthcare powerhouse. The state has invested heavily in building a comprehensive support network for seniors, including top-ranked hospitals, long-term care facilities, and home health providers. And unlike some flashier states, Wisconsin actually delivers where it counts: consistency, access, and affordability. Wisconsin's out-of-pocket costs for retirees are shockingly low, 15 to 20% below the national average. That's not just pocket change, it could mean thousands saved each year. This state's cost of living index hovers around 100, and with a GDP of $350 billion, Wisconsin isn't just managing, it's thriving. Hospitals in Madison and Milwaukee are recognized for seamless care coordination, which reduces medical miscommunications that plague so many seniors nationwide. But what makes Wisconsin unique is its integration. Seniors don't just have access to care, they have access to connected care. The patient data systems across hospitals, clinics, and specialists talk to each other, which slashes wait times and improves health outcomes. And with a robust network of geriatric-trained professionals, Wisconsin's healthcare isn't just reactive, it's preventative. Still think Wisconsin is only about cold winters and Friday fish fries? Think again. The real heat is in its healthcare model, and it's putting bigger, richer states to shame. Number 9, Virginia. Virginia is proof that you don't need to pay a coastal premium to get coastal quality care. With standout hospitals like the University of Virginia Medical Center and Inova Fairfax, the state punches far above its weight in geriatric care. These facilities have been consistently ranked for excellence in elder medicine, and more importantly, they're accessible to the people who need them most. What makes Virginia shine in 2025 is balance. The state offers over 80 Medicare Advantage plans, giving retirees flexibility in choosing the best coverage for their unique needs. That means more choices for dental, vision, hearing, and chronic care options, services that are often neglected in other states. And unlike overburdened systems elsewhere, Virginia's provider density remains strong. Financially, Virginia is an underrated gem. With a 2023 GDP of $550 billion and a cost of living index of around 105, the state manages to maintain affordability without sacrificing quality. Nearly 95% of retirees report satisfaction with their access to senior healthcare services. That's a number most states would kill for. Is this the blueprint for future retiree care? If so, Virginia may be far more than just for lovers, it's for survivors. Number 8, Hawaii. Yes, Hawaii is expensive. But what price would you pay for longer life, better care, and more sunshine? In 2025, Hawaii continues to set the national standard for senior health outcomes, even if your wallet has to take a hit to get there. With the highest number of geriatricians per capita and cutting-edge care coordination, Hawaii is less a state and more a senior healthcare utopia. The average life expectancy among seniors in Hawaii is now pushing past 84 years compared to the national average of 76. That's not a fluke. With nearly 90% of seniors receiving medical care within 10 miles of home, Hawaii ensures rapid, convenient access, no small feat considering the state's geographic spread. Add in exceptionally low hospital readmission rates, and you've got a system that works. Of course, it comes at a cost. Hawaii's cost of living index soars around 181, and with a 2023 GDP of $97 billion United States dollars, the state is economically constrained. But retirees who can afford it aren't leaving. They're living longer, healthier, and happier. So the real question is, can you afford not to retire in Hawaii? Number 7. Nebraska. It's not glamorous, it's not flashy, but Nebraska delivers where it matters most. Affordable senior care. The state is a leader in preventative and nursing home care costs, offering services that are significantly cheaper than coastal states without compromising on quality. In fact, nursing home care in Nebraska costs up to 25% less than in places like California. Nebraska also boasts a dense and accessible network of primary care physicians and geriatric specialists. For a state with a 2023 GDP of $125 billion and a cost of living index in the mid-90s, that's a remarkably efficient system. And efficiency is everything when you're dealing with chronic conditions, limited mobility, or fixed incomes. What sets Nebraska apart is its commitment to long-term senior wellness, not just emergency treatment. With strong community-based healthcare models and early intervention protocols, it's not just about living longer, it's about living better. If you think Nebraska is just cornfields and cattle, you're not just underestimating the state, you're underestimating your own retirement potential. Number 6. Iowa. Iowa proves that reliability can be revolutionary. In 2025, it stands as one of the top 5 states for timely senior care, virtually eliminating the waiting lists and appointment gaps that plague so many regions. For retirees, that translates into one word: dignity. With a 2023 GDP of $200 billion and a cost of living index of about 95, Iowa combines economic sense with medical excellence. It ranks consistently among the most affordable states for seniors, offering discounted rates on audiology, cardiology, and preventive checkups. That's not just smart, it's life-saving. And here's the kicker: Iowa's senior care costs are typically 30% lower than the national average. 30% lower. That's thousands of dollars annually that retirees can redirect toward living instead of just surviving. In an age when Medicare doesn't go as far as it used to, Iowa is quietly rewriting what's possible for affordable elder care. And that's just the beginning. Number 5. North Carolina. In North Carolina, retiree healthcare isn't just adequate, it's downright exceptional. The state is home to premier medical institutions like Duke University Medical Center and UNC hospitals, both consistently ranked among the nation's best for geriatric care. What's shocking? Seniors in North Carolina have access to over 90 Medicare Advantage plans, complete with dental, vision, hearing, and chronic care options, benefits most states don't even offer. Despite this, North Carolina maintains affordability, with a cost of living index around 100 and a 2023 GDP near $700 billion. Retirees routinely engage with regular physicians, over 95% visitation rate, a marker of a system built around accessible, proactive care. And it's not just about numbers, it's about quality of life, timely appointments, well-coordinated services, and minimal red tape. North Carolina's senior care ecosystem is built for resilience. With lesser hospital readmissions and robust home health supports, seniors aren't just treated, they're supported for life. In a healthcare landscape rife with profit-driven models, North Carolina offers a rare alignment of quality, access, and cost efficiency. But here's the kicker: this robust infrastructure isn't accidental, it's the result of strategic investment and visionary policy. And for retirees, that means peace of mind in an unpredictable world. Number 4. Florida. Florida continues to rewrite retirement standards. It's not just the sunshine that draws seniors, but the healthcare too. With a market swelling to over 120 Medicare Advantage plans statewide, Florida offers unmatched choice and flexibility. Its healthcare infrastructure includes top-tier facilities like Cleveland Clinic, Florida, and multiple specialist networks focused on elder care. Economically, Florida rings in at a 2023 GDP exceeding $1 trillion. With a cost of living index near 115 and no state income tax, the state makes high-quality care much more affordable. Imagine benefiting from improved mental health services, chronic disease management, and advanced medical referrals without the dread of clipping your budget. The real standout is satisfaction. Around 85% of Florida seniors report high contentment with their healthcare access, a rarity in the national narrative. This isn't just about policies, It's about outcomes: healthier retirements, preventable hospitalizations, and reliable long-term care. But here's the truth: no one wants to admit Florida is doing for retiree health what Silicon Valley is doing for tech, innovating rapidly, scaling solutions, and leaving laggards in the dust. Number 3. Colorado. Colorado is rewriting the rules on retiree health with an active twist. This is a state built for longevity, not just through clean air and trails, but through integrated care systems centered in health-literate cities like Denver and Boulder. Hospitals like UC Health and SCL Health ensure seniors benefit from outcome-driven medical excellence. Retirees here enjoy a lifestyle deeply interwoven with wellness. Obesity rates under 25% among seniors, fresh mountain air, and community strength. That lifestyle isn't incidental. It translates to 15% fewer hospitalizations than the national norm. Financially, Colorado is sustainable. A 2023 GDP around $380 billion and cost of living index near 110. The state's healthcare ROI isn't measured just in dollars but in reduced chronic disease, fewer ER visits, and mobile health units that bring care to rural retirees. But what comes next will shock you. Colorado's healthcare game isn't plateauing, it's accelerating, and life expectancy among the elderly continues to climb. Number 2. Massachusetts. Massachusetts is more than historical prestige, it's the healthcare powerhouse of American retirement. With globally revered institutions like Massachusetts General and Brigham and Women's, retiree care here isn't just robust, it's legendary. And with over 110 Medicare Advantage plans available, many including top-tier add-ons like dental, hearing, and mental health coverage, it's a retiree's dream. Despite a wellness price tag cost of living index around 130, seniors benefit from medical outcomes that suggest an additional 2 to 3 years of life expectancy compared to the U.S. average. Boston's medical delivery. It's predictive, preventive, and personalized. But it's not just about access, it's about adaptability. From telehealth for rural retirees to integrated home visit programs, Massachusetts is innovating eldercare faster than any state in the nation. So ask yourself, would you trade comfort for cost? In Massachusetts, healthcare is worth every penny if you can afford it. Number 1. Minnesota. Number 1 is not a surprise. Minnesota sits at the pinnacle thanks to a healthcare ecosystem built around senior well-being. With over 100 Medicare Advantage options, A+ rated geriatric services, and one of the nation's highest densities of geriatricians, about 25 per 100,000 seniors, Minnesota is a living laboratory in eldercare. The state's impact on health outcomes is real: 20% lower hospital readmission rates than the national average, underscore a system built for efficiency and effectiveness. And with a GDP of $400 billion and cost of living index near 102, Minnesota hits the sweet spot of quality and affordability. This is a place where care coordination isn't just buzz, it's baked into how the system works. Seniors benefit from seamless electronic health records, connected clinics, and follow-up programs that keep them out of the hospital and in their homes, living well. If you're planning a long retirement, Minnesota isn't just your next stop, it's your best decision. These 10 states aren't just healthcare leaders, they're living proof that where you retire could define how you live. From Wisconsin's steady model to Minnesota's cutting-edge senior-focused system, these states show that affordable, accessible, and high-quality care isn't a myth, it's a choice. Which brings us to the question: are you choosing wisely? Because the wrong zip code won't just affect your savings, it could determine your health outcomes for decades.